First of all, I'd like to respond to Sam's original claim that there would be a chance of abuse of the doctor's powers. There are, in the Physician-Assisted Suicide Act in Oregon, the Death with Dignity Act, in their 2008 summary of all the cases that were undertaken with this act, says during 2008, 2 referrals were made to the Oregon Medical Board for incorrectly completed reporting forms. The Oregon Medical Board found no violations of good faith compliance with the act and did not sanction any physicians for unprofessional conduct regarding the act. So they can be brought to court if they do something wrong, but there's things in the act that prevent that. And in the Netherlands, there are in the provisions for their Euthanasia Act. The Euthanasia Act contains provisions governing requests for termination of life or assisted suicide by minors and recognizes the ability of written wills. And doctors may grant both oral and written requests for euthanasia, but are never obliged to do so. So even if the patient decides that they want to commit suicide, the doctor does not have to comply with their request if they feel that it violates their doctorly duties. And in Belgium, they have a Euthanasia Act. In the article, the Belgian Act of Euthanasia of May 28, 2002, says any physician who has performed euthanasia is required to fill in a registration form drawn up by the Federal Control and Evaluation Commission established by Section 6 of this Act, and to deliver this document to the Commission within 4 working days. So there's all sorts of laws put in place to protect patients against doctors abusing their power. And Sam also talked about how terminally ill patients do not have rights in the Constitution to end their suffering. In the case Tobacco versus Quell, and the American Civil Liberties Union, in their amicus brief, that it states categorical ban on physician assistance to suicide as applied to competent terminally ill patients who wish to avoid unendurable pain and hasten inevitable death substantially interferes with this protected liberty interest and that cannot be sustained. They're saying that patients do in fact have the right to end their own lives if they feel that they're suffering too much. And most of the patients who participate in the Death with Dignity Act in Oregon said that their most frequently mentioned end-of-life concerns were loss of autonomy, the decreasing ability to participate in activities that made life enjoyable, and their loss of dignity. They have statistics on what these patients are thinking and how they feel that their rights are being violated by being this sick. So, Jen also spoke about patient discrimination and how it discriminates against poor people. So, in the Oregon Death with Dignity Act 2008 summary, it said that participants were between 55 and 84 years of age, white, well-educated, and had at least a BA in 2008. 60% had at least a BA, compared to 41% in previous years. And so these people that are having this done are well-educated. They know what they're talking about. They're not poor, resorting to the last thing. And our affirmative plan, when put into action, it would be that a patient of 18 years or older can petition for physician-assisted suicide if their consulting physician deems them to be terminally ill. So they have to talk to a psychiatrist and make sure that they're not mentally ill, and that the doctor also has the right to refuse, and the patient has the right to rescind their request.